Hello, my name is Kathy McManus and I'm a dietitian in Boston, and I want to invite you to a cardiovascular nutrition symposium in Amman, Jordan on December 15th. I'm very interested in this topic of dietetics since I started my career at Brigham and Women's Hospital, a Harvard teaching affiliate. I started in our coronary care unit in the ICU caring for patients with cardiovascular disease. I've also worked in an outpatient setting, examining patients that have risk factors for cardiovascular disease, including diabetes, hyperlipidemia, and hypertension. I'm also very interested in the area of research in cardiovascular disease and have had the opportunity to work on a number of major clinical trials involving heart disease and diet interventions, along with obesity. Currently, I'm the Director of Nutrition at Brigham and Women's Hospital and also the Director of our Dietetic Internship Program. But my true passion lies in seeing patients. I also am part of 3 different clinics on cardiovascular disease. One involving primary and secondary prevention of CVD, and also a heart failure clinic where I see patients with cardiomyopathy and some post-heart transplant patients. I also work in our women's health clinic and am involved in helping women reduce risk for cardiovascular disease. On December 15th in Amman, I plan to present the science and practice of heart-healthy eating. We'll begin the morning by looking at some of the epidemiologic trials along with the clinical studies, including PREDIMED, DASH, OmniHeart, and other major trials that support diet intervention and the importance of our practice. We'll also take a look at some of the different major guidelines, including the American Heart Association, lifestyle recommendations, the soon-to-be-released hypertensive clinical practice guidelines, and the 2015 to 2020 dietary guidelines. We'll also talk about some of the case studies that will be presented, in addition to healthy dietary patterns around the world. However, we all know that information is only part of the story. The other main key is helping our patients make lifelong behavioral changes. So what I plan to do is to present information on motivational interviewing, in addition to counseling and coaching strategies that we can use to help support our practice. And we'll talk about some strategies to help decrease these barriers, to help support and help them learn some of the environmental triggers that promote unhealthy eating. Look forward to seeing you on December 15th.